Hello, everyone. Thank you all for joining us today for the Centers for Medicare and Medicaid Services Office of Minority Health's Minority Research Grant Program Application Assistance webinar. My name is Jessica Dawson, and I'm a Black woman with box braids wearing a white blouse. We are so pleased to have you join us today. Before we dive into today's webinar, I would first like to share the purpose of this webinar. The Minority Research Grant Program Application Assistance webinar sessions are designed to provide additional assistance by giving background information as well as firsthand experience from current and previous grantees who will talk about their experience and answer any questions that you might have. We hope today's session will help you get more familiar with our program, especially as you consider whether your institution would like to apply. Joining us for today's webinar is our 2022 grantee, Dr. Karen Pellegrin from the University of Hawaii, and our 2020 grantee, Dr. Zhang from the University of North Texas. They will share their experience applying for the grant and then briefly speak about their MRGP-funded research. We would like today's session to be an opportunity for you to learn about the Minority Research Grant Program broadly, but also from the perspective of grantees who were previously in your shoes. Next slide, please. Today's session will begin with an overview of the Minority Research Grant Program, followed by presentations from Dr. Karen Pellegrin and Dr. Zhang. Then we'll share details on the 2024 Notice of Funding Opportunity, including eligibility requirements and how to apply via the grants.gov website. Following these items, we will conclude with time for questions from the audience. On this slide, we also have instructions regarding accessibility for today's event. To access the live transcript feature, go to the menu at the bottom of the screen and click on the live transcript icon. After you click the icon, click on View Full Transcript, which will allow closed captioning to appear on the bottom of your screen. And the transcript will show on the right-hand side of your screen. Next slide, please. As many of you most likely know, CMS is the largest provider of health insurance in the United States, responsible for ensuring that the more than 170 million individuals supported by CMS's programs can get the care and health coverage they need and deserve. The Centers for Medicare and Medicaid Services Office of Minority Health is one of 8 offices of minority health within the U.S. Department of Health and Human Services. We work with local and federal partners to eliminate health disparities while improving the health of all minority populations. Next slide. And next, I'll be providing a brief overview of the Minority Research Grant Program. Next slide, please. The Minority Research Grant Program, also referred to as MRGP, is administered by CMS OMH to support researchers at minority-serving institutions that explore how CMS can better meet the healthcare needs of the populations we serve, including people from racial and ethnic minority populations. Apologies for my Outlook notifications. I should have silenced those. People from LGBTQ plus persons with disabilities, persons of limited English proficiency, and persons who live in rural areas, and persons who are otherwise adversely affected by persistent poverty or inequality. Additionally, the MRGP supports CMS's efforts to advance health equity by increasing understanding and awareness of health disparities, developing, disseminating solutions, and implementing sustainable actions. Next slide, please. For the last 2 decades, CMS has provided MRGP grantees with funds to further health equity research that supports researchers pursuing topics that impact minority populations, investigates the root causes of health disparities, and fosters dissemination of grantee research within CMS programs. The grant program gives our communities the opportunity to benefit from the research, as well as fantastic opportunities to help minority-serving institutions and health equity researchers grow their work and the portfolio. Next slide, please. At this time, we will watch a short video highlighting the MRGP. This has been updated to include a few new minority-serving institutions eligible to apply this year.
The Minority Research Grant Program helps researchers at minority-serving institutions like yours build a portfolio while funding studies that are important to the healthcare needs of people who are medically underserved across the nation. As a grantee, you can investigate the root causes of health disparities, share best practices for reducing these disparities, and improve the health of all minority populations, including racial and ethnic communities, people with limited English proficiency, lesbian, gay, bisexual, transgender, and queer or LGBTQ plus persons, persons with disabilities, persons who live in rural areas, and persons otherwise adversely affected by persistent poverty or inequality. Becoming a grantee allows you to partner with the Centers for Medicare and Medicaid Services, grow your research credentials, increase the public's knowledge on health equity, and share your findings to join the ranks of other Minority Research Grant Program awardees who have published dozens of manuscripts that have been widely cited. For over 2 decades, Minority Research Grant Program awardees have uncovered health equity barriers and solutions in the U.S. by addressing a variety of issues in chronic conditions and healthcare access. The Minority Research Grant Program strengthens the capacity of historically Black colleges and universities, Hispanic serving institutions, tribal colleges and universities, Asian American and Native American Pacific Islander serving institutions, Native American serving non-tribal institutions, Alaska Native and Native Hawaiian serving institutions, and predominantly Black institutions. The MRGP also helps widen the pipeline of researchers making a difference in disparities affecting minority healthcare. To learn more about the Minority Research Grant Program, eligibility requirements, and how to apply, visit go.cms.gov/minorityresearch.
Thank you for sharing that video. We do hope that you were able to find it useful. It is available on our organization's YouTube page. And now I will turn it over to our next speaker, Brian Young from the CMS Office of Minority Health, to review the goals of the MRGP. He's also our MRGP lead and our resident expert on all things MRGP. Without further ado, Brian.
Thank you, Jessica. Hello, everyone. My name is Brian Young. I am a public health advisor within the CMS Office of Minority Health. I am a Black man with dreadlocks, and I am wearing a tan sweater. Through the Minority Research Grant Program, we've set to achieve several goals. The first is to develop capacity at minority-serving institutions to research health disparities and social determinants of health. This support for minority researchers helps them grow to a point where they can conduct research independently and be competitive for other major grant support. Next slide, please. So the second goal aims to understand the root causes of issues that lead to health disparities and identify repeated interventions. Institutions investigate these root causes by exploring local conditions and populations, specifically medically underserved populations. Next slide, please. And lastly, the research funded by the MRGP uses various methods to broadly disseminate best practices for addressing health disparities, providing culturally competent care for all patients. CMS reviews these findings and best practices to strengthen CMS programs. Next slide, please. So I'd like to share a few summary highlights from the 54 grantees funded between 2005 and 2022 MRGP cycles, so you can better understand the impact MRGP has had on the grantees and that the grantees' research has had in the communities. The MRGP has funded a wide range of projects focusing on various populations that experience health disparities. Grantees from historically Black colleges and universities and Hispanic serving institutions have focused on health disparities affecting African Americans and Hispanics, respectively. Through research efforts funded through the Through research efforts from the funded grantees, we were able to see the impact MRGP has had. Many of the grantees reported disseminating their findings academically through peer-reviewed journals and at conferences, as well as to the communities they have collaborated with during their research. The Minority Research Grant Program is an opportunity for health equity researchers to not only expand their research efforts, but also disseminate their findings through diverse methods. Next slide, please. We have funded health equity researchers at minority-serving institutions through the MRGP for 2 decades. This slide shows our 2023 grantees: Morgan State University, University of New Mexico Health Sciences Center, and California State University San Marcos Corporation, who have all examined critical health disparities. Next slide, please. So now I'd like to introduce one of our featured grantees, Dr. Karen Pellegrin, on behalf of the University of Hawaii. Dr. Pellegrin, you may begin.
Thank you so much, Brian. Aloha, everyone. I'm Karen Pellegrin, faculty at the Daniel K. Inouye College of Pharmacy since 2008, before our college had a name. Our college was named after the late senator who was born in Honolulu 100 years ago this year. He witnessed firsthand the attack on Pearl Harbor, and he volunteered for military service as soon as our government reversed its policy declaring Japanese Americans as enemy aliens who were unfit to serve. He became a decorated hero who lost his right arm in combat in World War II. He was an elected member of Congress since Hawaii became a state in 1959 until he died in 2012. He was known for being warm and kind and relentless in pursuit of equality and health equity. He located the College of Pharmacy on the rural Big Island rather than in urban Honolulu, where the medical school was located, so that our college could play an important role in advancing health equity. Thank you for this opportunity to share our project with you. IMUA stands for Improving Medication Use to Achieve Health Equity among CMS beneficiaries. IMUA in Hawaiian is also a call to action, a call to move forward. Next slide. So this project is a call to move forward to address health disparities through a health IT enhanced research effort focused on medication use. I'm joined by co-investigator Dr. Wes Sumida in leading this project. CPESN is Community Pharmacy Enhanced Services Network, our lead operating partner, which will be testing and implementing new models. HHIE is Hawaii Health Information Exchange, our lead IT partner. Next slide. Our college has a long history of working with these partners in both education and research. I've worked with HHIE for over a decade, and I've served as a volunteer board member for them since 2017. So I encourage you to leverage your established partnerships as you work on your grant application. This is an opportunity to advance your work together. Next slide. This is also an opportunity to leverage other grant awards and projects. Think about your work as interconnected. How does your previous work and results inform your thinking and hypotheses going forward? In our project, we leveraged a previous CMS-funded project and PICO project funded by NIH. PICO is the Center for Pacific Innovation, Knowledge, and Opportunities. In our project, we're also leveraging a new data tool that we developed with funding from a Health Equity Award from the Office of Minority Health to Hawaii County. Next slide. In our previous CMS-funded award, we launched a pharmacist-led care transition and care coordination model focused on medication management. After a 3-year baseline period with no differences, those hospitals that implemented our model had a significant reduction in medication-related hospitalizations among those age 65 and older relative to the hospitals that did not implement our model. The annual cost of the pharmacists in the model was under $2 million, while the hospitalizations avoided due to our model saved over $6 million, achieving a 264% return on investment in the pharmacists. Next slide. At baseline, the percent of hospitalizations that were medication-related among older adults was double that of younger adults. We demonstrated that health equity between older and younger adults can be achieved and achieved in rural areas. Next slide. In our current project, we continue to focus on rural health disparities among CMS beneficiaries. In addition, we're focusing on health disparities among Native Hawaiians and other Pacific Islanders and among those with socioeconomic vulnerabilities. Next slide. It's important to identify and target health disparities and to make sure you've identified how you will measure them. Next slide. The data tool we developed with previous funding for a project called Kuleana Health is a novel use of a statewide HIE system. This tool looks up the census tract where each patient lives so that we can create population measures of acute care use and identify links to specific vulnerabilities by census tract. Why is this important? Well, we cannot change what we cannot see. Typically, acute care use is tracked by hospital, but that's a healthcare-centric perspective. The Kuleana Health dashboard allows us to see the connections between acute care utilization and social vulnerability from the community perspective, so that resources and interventions can be more efficiently and effectively deployed to improve health and health equity. Next slide. In this example from our pilot project, the county asked, how frequently do children age 5 and younger from Pahoa use the emergency department? Pahoa is an underserved town in the underserved Puna district on the Big Island. With our Kuleana Health dashboard, we were able to not only answer that question, but also to drill down to the 3 census tracts that comprise Pahoa and identify that the census tract with the highest socioeconomic vulnerability had the highest use of emergency department among children. Next slide. So we looked at the goals of the CMS Minority Research Grant Program and began shaping our work to align with these. Next slide. The goals of our project are to develop statewide infrastructure to support medication use health disparities research with a focus on social vulnerabilities through our Kuleana Health dashboard, to test pharmacist-driven scalable interventions to address the root causes of medication use disparities, and to disseminate models that reduce these disparities. Next slide. We also aligned our project objectives with the CMS Health Equity Framework priorities to address systemic barriers to equity. To support data standardization, we're enhancing the Kuleana Health dashboard to allow drill down to the subset of acute care use that's medication related. Next slide. We've adapted the farm-to-farm model to align with the Medicare Advantage STAR measures, reduce medication-related hospitalization, and close equity gaps. Next slide. We've added to this model a screening tool to allow pharmacists to better address the social determinants of health that drive disparities. Next slide. Our project is also enhancing the capacity of our community pharmacists to serve as training sites so that our pharmacy students can gain experience in health equity models. Next slide. Finally, we're exploring HHIE data sources to support future work in addressing disparities among those with disabilities. Next slide. We've already identified that the CDC's social vulnerability data in our Kuleana Health dashboard includes a disability measure that may be important in this future work. So you can see the interconnectedness of our previous work with our current project and future directions. Next slide. A few other important tips to keep in mind as you work on your application. This program does have a cost-sharing requirement of 1% of the project's total cost. There's also an indirect rate cap of 8%. If your negotiated rate is higher than this, consider requesting the balance to meet your cost-sharing requirement. Finally, the business assessment. It does take time, and you may need to get help from your administrative team to answer these questions. Next slide. If you receive an award, do make sure that you practice good project management. There will always be challenges. Use these as opportunities to build relationships. We had a lengthy delay in starting up our project due to shortages in our staff shortages in our grants office. Working internally and with CMS, and this is a shout out to our program officer, Brian Young, for all the help in getting through those challenges and getting our project up and moving. We're now working hard on getting caught up. Most of all, never lose sight of the importance of our mission to achieve health equity. Next slide. And never forget why you are where you are doing what you're doing. So IMUA, move forward on your application. Good luck and thank you. I'll turn it back over to you, Brian.
Thank you so much, Dr. Pellegrin. We really, really appreciate your presentation today. So next slide, please. So I will now pass it over to Dr. Zhang on behalf of the University of North Texas. Dr. Zang, you may begin.
Thank you, Brian. Hello, everyone. My name is Zhang. I'm a professor of kinesiology at the University of North Texas. Next slide, please. Today, I would like to share my grant application experience. Based on my personal application experience, I believe it's quite important to find our notice of grant opportunities as early as possible. You need to read carefully about all this grant application requirement, such as cost sharing requirement. It is quite important for this grant opportunities. And also, you need to make sure learn about the eligible organization, after reading this guideline, because your university should be minority serving this institution, and just to make sure you can meet this eligibility requirement. My next tips for this grant application is to work close with your organization grant officers. It is quite important to complete so many different mandatory registration and requirement. So please do such preparation as early as possible. You need to just make sure follow all this guideline and complete all these registrations. Next, you also need to prepare for this grant application draft as early as possible, because it will be comprehensive application document. So you need to think about your project narrative. How can you have a good draft for your narrative to highlight your project overall impact? What's your typical research significance and the research innovation? I believe it will be very important component when you prepare for your grant applications. And then you also need to highlight the specific research approach, and then make sure you have a very nice preparation for different component of your research approach, and then make sure your research is innovative and important. Also, you need to think about what's your typical research collaborators. Okay, your research team will be very important for your research grant success. So we hope that you can have a good expertise to complete your grant application, and once funded, you also can complete this grant with good qualities. Next, you also need to highlight your research environment within your organization, and please make sure you have all these available resources and equipment to complete your project. So we believe it is quite important for you to have a good checklist for your application, and you need to make sure can follow all this application process as suggested in the grant opportunity guidelines. The last point I want to highlight is how can you prepare for your grant application from a reviewer perspective. You need to think about all this evaluation criteria and different component, and just to make sure you can get the maximum point from your grant application. Next slide, please. For the past few years, my research team has gotten very strong, technical support from minority research grant programs. We appreciate it very much. Especially, we think, it's quite important to have this 1 year no-cost extension, especially during this COVID-19 pandemic. Our project has been done within 3 years windows, 2020 to 2023. So with a 1 year's low-cost extension, we can successfully complete our grant project and make sure we have good qualities. In addition, we noticed the use of this multiple sites for data collection and intervention during and beyond the COVID pandemic present a very big challenge for us. We met such a big challenge and barriers during our data collection and data analysis. So we appreciate all this technical support from minority research grant program, and they give us a very good recommendation and suggestion for all this potential presentation and publications. I believe reducing health disparity and offering promising practices to address the social determinant of health are key for your successful grant application. So you need to highlight this key point. How can you find a good solution to health disparity and also work closely with your local community and different organizations to make a good application materials? Next slide, please. Now I would like to introduce our previous research grant project a little bit. Our grant project title is a minority obesity vanquish with education move in health staff. We emphasize this low-income family and the children in health staff center because we believe it's quite important to find a good solution to fight the childhood obesity within this underserved population and the communities. So I would like to give you a little bit of this project background and our research methodologies. And I also would like to share our key research funding. Next slide, please. Based on our previous literature review, we noticed preschool age children from low-income families may be more sedentary, overweight, and lack fundamental motor skills. Based on our previous pilot research project, we noticed the majority of our health staff school age children spend about 30% of their school time in sedentary behavior. So we need to find a good solution to enhance their physical activity engagement. And among them, over 58% of these health staff children were overweight or obese. So we also need to think about what a typical approach we can fight the childhood obesities. And also based on our previous research evidence, we noticed majority of this health staff preschooler have this delayed fundamental motor skills. So that's why we think it is necessary to find a good approach to enhance just fundamental motor skill in order to increase just physical activity participations. Next slide, please. So guided by the whole school, whole community, whole child model, the major purpose of our previous research project MOVE was to determine the efficacy of a health staff center-based and the home-based physical activity intervention on just low-income family and the children, especially just the health outcome, including just the weight status, physical activity and sedentary behavior, fundamental motor skill, and the health-related quality life. Our project was designed to create and sustain a comprehensive, developmentally and culturally appropriate physical activity intervention, and we hope we can find an integrated approach, such as multi-level, multi-site intervention approach to combat childhood obesity, and in order to promote all these kids' healthy development. So we hope we can create a good and then a positive learning environment in both the health start center and the home settings. Next slide, please. So this project move used the 2M class randomized experimental research design, and then we also made the necessary modification due to the COVID-19 pandemic. A mixed method approach of using a qualitative and the quantitative data analysis allowed our project intervention to be reviewed and to learn how can we promote all this health start children and families of physical activity within the school and at the home. Next slide, please. So we have a different intervention component within this project. First, I want to highlight the center-based intervention component. We have 5 important approaches or components to highlight physical activity and health promotion. The first one is center-based physical activity policy change. Second component is physical environment changes, and we also have staff training and education to educate all this center teachers and directors to have a better understanding about the physical activity importances. We also implement the fundamental model skill-based research session delivered by our project staff, and we also provide a center-based family event in order to promote just physical activity participation. Next slide, please. This project also includes the home-based intervention component, such as home-based physical activity environment innovation. We also use the pedometer-based working for heart program to enhance family physical activity participation, and we use different type of this parent education component to emphasize how can they to be physically active at home. So we sent out all this newsletter and the checklist to help them to be physically active in their spare time. Next slide, please. So this slide shows our project moves the concept model. As you can see, we have a center-based intervention and a home-based intervention in order to provide a different type of intervention strategies to promote all these kiddos physical activity and enhance just fundamental motor skill competence and increase just the healthy and quality life. So we emphasize center-based changes, children's levels changes, and the parent accountabilities. Next slide, please. And this figure show our this assessment flow chart of this project. For the past 3 years, we enrolled about 256 children and families amongst 12 different health start centers. So as you can see, we have a 6 center as an intervention group and a 6 center as weekly control group. We have a multiple pre-assessment and post-assessment in order to have a good data collection. And we also have a good focal group interview for parent and the center director to understand what the typical value and the facilitator for their physical activity participations. Next slide, please. And we met so many different values during our data collection. As you can see during COVID-19 pandemic, we met big recruitment challenges due to staff and the teachers shortage. And engaging with parents with a great physical activity participation and the project engagement is also a big challenge throughout this project durations. It will be important to learn how to engage with all these parents because they have a high quotient and this energy challenges. So we believe it is quite important to understand how can we have good this community engagement and the family engagement during our data collections. Next slide, please. And I would like to share the key funding from our pilot digital project. As you can see, Health Start step-in approach and the value center-based intervention, especially our fundamental model skill-based research sessions. And the Health Start step use our playground equipment and supplies provided by our project, and they have a physical activity, policy change, and the practice innovations. So we believe it is quite important to have such support for our Head Start center director and classroom teachers. It was challenging to find the time and the day for family to engage in physical activity during and beyond the COVID-19 pandemic. And we also noticed family physical activity was demonstrated when preschool were being picked up and the idea was shared to be used with the family at home. Next slide, please. So we believe that our project addressed a very important research gap in health disparity and the social determinant of health. So we believe that this project reduced the health disparity among our Head Start children and the family and provide very promising practices and good recommendation to influence health equity and address social determinant of health. Next slide, please. So we believe it's quite important to have a healthy and physically active lifestyle. And that's why we think we need to find a good solution to promote the physical activity and reduce sedentary behavior among our children and family in Head Start. Thank you. Please return the slides to Brian.
Thank you. Thank you, Dr. Zhang, for sharing your experience and sharing your research findings with us today. Next slide, please. So next, we'll review MRGP's Notice of Funding Opportunity. Next slide, please. So I'm very excited to share that on April 1st, 2024, CMS OMH released the 2024 Minority Research Grant Program Notice of Funding Opportunity. We are now accepting applications via grants.gov, and the deadline to submit applications is Monday, June 3rd, 2024. This year, we plan to award up to 5 grants, totaling $255,000 each, with the grand total of $1.275 million to eligible institutions. Next slide, please. So now, before we provide a demonstration on how to properly submit an application through grants.gov, I would like to go over some of the eligibility requirements. Next slide, please. Applications undergo a thorough review process, evaluating the level of innovation, community collaboration, and scientific rigor. To be eligible, researchers should focus on developing suitable interventions for health disparities impacting minority populations. Health equity researchers with suitable projects from the following types of minority-serving institutions may apply: historically Black colleges and universities, Hispanic-serving institutions, tribal colleges and universities, Asian American and Native American Pacific Islander-serving institutions, Native American serving non-tribal institutions, Alaska Native and Native Hawaiian serving institutions, and predominantly Black institutions. For more information on eligibility requirements, you can visit the program's webpage listed on the screen. Next slide, please. So now we will provide a demonstration on how to properly submit an application through grants.gov. Next slide, please. When you visit grants.gov, the first thing you will need to do is click on the Search Grants tab. Next, you will type the MRGP grant number into the opportunity number box and click Search. Make sure to include the dashes as they are part of the grant number. Next slide, please. So once you clicked Search, the MRGP grant number will appear and you will proceed by clicking on the actual grant number. Finally, the Minority Research Grant Program Opportunity Number will appear, providing more information, such as the grant synopsis and eligibility requirements. Once you have completely read all of the MRGP requirements, you will proceed by clicking Apply. Next slide, please. So now we will move on to the question and answer portion of the meeting. So you can submit your questions via the Q&A feature. We will answer as many questions as time allows.
Okay, there are 2 questions so far in Q&A. The first one looks like it's for you, Brian. It says, thank you, the first few for mentioning the 8% direct cost cap. I read the application announcement and the 8% indirect cost cap is for the training award. Would Brian please elaborate on the training versus non-training proposal categories/applications?
Could you please send me an email? We're going to show the email at the end, because this is something, like I said, really, really specific. So I would like to write it all out. And I would also like to get our grants leads, the grants office, to help me write out the answer for you. Thank you for the.
And then the next question, I see Dr. Zhang already came off camera, but this question is for you, Dr. Zhang. And I can read it out, or looks like you already know what it is.
Yeah, I noticed that. Yes, this project has been approved by my university IRB office, and also we have multiple sub IRB this document to do our data collection, such as data collection from children, from family, from center director and the classroom teachers. So we have this qualitative and quantitative data collection component. And we believe yes, it was a challenge to collect all these different type of data during and beyond the COVID-19 pandemic. So that's why we have a this long-term just like partnership made a difference for us, because for the past decade we developed such good partnership with a health star center in Forward. So even during COVID-19 pandemic, yes, we still was able to complete our data collection. Thank you.
Thank you, Dr. Zhang.
Last thing, any more questions?
Thank you.
So we'll give it a couple minutes. So we do have a question. Do you consider supporting non-traditional forms of health, such as gun violence? So we can't specifically tell you yes or no, but I would say that yes, there have been some non-traditional methods that we have awarded over the past years.
Stuff like will we enter some proposal? Machine.
So, 1 second. Okay. How long does it take after the deadline to find out if you're successful? So we usually award in September, so a couple of months. Are you available to speak to PIs about the proposed project? Unfortunately, we cannot talk about your subject of your application. We can only answer questions after the review process is over. Yes, this recording will be available on our website. You're welcome. Well, okay, I'm going to continue with the presentation.
Okay.
Thank you all for your questions. So, Jessica, I will now turn it back over to you to close out.
Thank you, Brian. Next slide, please. So listed on the slide is our contact information. We have several of our mailboxes listed here, with the main one being OMH grants at cms.hhs.gov. We encourage you to visit our website at go.cms.gov/OMH and sign up for one of our listservs so that you can stay up to date on all of our health equity-related initiatives. We want to thank all of you again for joining us today. We do hope this session was helpful in helping you to better understand the Minority Research Grant Program and encourage you to explore it for your institution. So thank you all for joining us, and I hope you have a great remainder of your day. Thank you to our presenters. Thank you, everyone. Thank you, Brian.
Thank you all.